Hello to all the viewers. It's my proud privilege to have with me a very dear student, Dr. Yokesh, who has secured an amazing rank, All India rank 25 in the NEET SS Medical Group Entrance Examinations. Yokesh, welcome and hearty congratulations.
Hello, sir. Thank you so much. Thank you so much.
So, I think, Yokesh, I'm sure the viewers would want to know a lot about yourself. I'm sure
Mhm.
that since you're already there in social media, many of them might know you, but still, can you just tell us, the viewers, where did you do your MBBS and then your post graduation from?
All right. So I did my MBBS from Bharati Vidyapit Pune, which is a private college, and I did my
Okay,
MD from GMC Midnapur, which is in
okay,
West Bengal.
right, great, great. And as you can see for the viewers, this is basically Dr. Yokesh's journey from PG residency to super specialty. Because what makes him very unique is that he has secured this amazing rank, just after he has finished his MD finals as well. So I'm sure that many of the future aspirants would want to know from him his preparation strategies as well. So before that, Yokesh, can you just tell us when did you think about doing super specialization in medicine and the journey during your residency as well? How beautiful was the journey, and then from here, at what point of your residency did you think about super specialization?
So I think medicine is a very exciting branch. So once during my first year residency, like I felt that every case was an interesting case. But around
Yeah,
second year residency, I realized that a lot of other cases are much more than PG. Now, even if
yeah,
you take a normal case of, let's say, of endocrine, a way a medicine resident sees it and a way an endocrinology resident sees it is totally different. The entire approach changes. So I felt there's much more depth into everything. And then I realized that super specialization is necessary, because those days people used to go to physicians as a primary consultation, but nowadays everyone are going to super specialists. So I think it is not only like personal choice, but I feel it's a need also for like
right,
almost every physician to get into super specialization, sir.
right, right. Right. So I think that is my opinion as well. I feel that though medicine is the epicenter, it would be very nice if you can be the master of one particular super specialization, because such is the advance that is taking place in this beautiful field of medicine. And to stay updated in all super specialties is slightly demanding. So I think I would agree with that. Now, Yukesh, again, for the viewers to know more about your preparation strategies, first about your journey with DocTutorials. Now, for super specialty entrance preparation, there are multiple platforms, but why did you think of DocTutorials as the platform for your super specialty preparation?
So before choosing a platform, I did a lot of research among my seniors and all, like
Okay,
what they recommended, and most of them, everyone suggested DocTutorials.
okay,
So even while preparing, first I did focus more on my MD exams, because MD finals exam itself is a very vast topic.
okay,
So I started reading Harrison gradually, and after
okay,
reading Harrison, whenever I found a important topic or a vast topic, I used to come to DocTutorials and used to watch that entire video. So
okay,
that concept becomes much more stronger. You get some extra points. It just happens simultaneously. So
right,
then I try to solve question bank also, but I didn't get much time. So before my MD exams, I did solve some questions, but not much, because I didn't have much time.
right. Okay. Right. So coming to the individual components of our course, first coming to the videos. Now, see, when you prepare for the super specialty entrance examinations, here again, it is important to master the concepts, especially for topics like neurology, cardiology. So watching the doc tutorials videos, how did it strengthen your concept building for your residency as well as for your entrance preparation?
Sir, I think neuro neuro is one system where the concept is the most important factor, right? Especially while localizing the lesion. And I think even in our MD finals, practical also, you cannot pass when the such questions are thrown at you. So
Correct.
that part was always been a gray area for me, because in my college, I feel that nowadays most of the colleges do not have extremely good academics, All right, case presentations do happen on and off, but not everywhere have good academics. So then when I watched your videos, at first you taught the anatomy and then you explain the pathology. So then you get a much more clearer understanding, like Brown-Séquard syndrome, syringomelia, all these basics. So once the basics become strong, even if a question is asked about something else, that option will be there. So when that
right,
option is there, it will be much easier to rule out. Okay, isme to ye hoga, this will happen. So it will definitely not be that one. So I feel in systems like neuro, nephro, all these things, the concepts are very important. Like what happens in the disease, and then you will be able to crack the MCQ.
right. And talking about MCQ solving as well, I think DocTutorials we have got a very good question bank as well, and
Yes.
which is actually a two-tier question bank, one based on the Harrison and the other based on the super specialty textbooks as well. So I would want to know about your experience with the question bank of DocTutorials, like approximately what percentage of the Qbank you had solved, and how did the Qbank solving help you in refining the MCQ solving approach?
All right, sir. So for what I did is, I think DocT has two question banks. One is Harrison based and one is SS based. So I think
Right,
the Harrison based has some 2,500 MCQs or something. So what
right,
I did is, I think I had some 60 to 80 days for my exam after my MD. So I
okay,
divided 300 divided by 60 days. So per day
right,
I had to solve around 90 to 100 MCQs or something like that.
right,
So I started solving in that way. So once you start solving that way, it covers all the gray zones also. Like let's say nephro, all these dialysis, all these are very hot topics,
right,
trying to test your concepts and this and that. So once you're done with all the topics, it gives you a much clearer understanding. And once you make a mistake in the question, now you will remember that forever. I feel that is always there. So
right.
that helped me a lot.
And all the references for these questions in the Q bank were from
Mhm.
Harrison itself. So maybe it would have helped you retrospectively go back to Harrison as well.
Definitely, sir. But I felt that I really didn't have the time to go back to Harrison. But I like the solution. In the solution itself, they'll mention page number this is there, this is there. So you'll get to
Right,
know what is there, what they're coming to say. And they also will give 2 to 3 extra points also. And I think in
right,
this NEET SS, there was this question where some embolism happened and they asked the kidney finding. And the answer was eosinophiluria. And
right,
that question, I made a mistake in the Q bank. I still remember, and that same question was asked in the GT also, and that same
right,
question came in the exam, and I blindly marked it. I was like, this is
right,
this, that finding, same, very similar pattern. So yeah.
right. And another point about the doc tutorials course is that we have always adapted to the NEET SS pattern as well as NEET SS dates also, I should say. Why?
Correct,
Because
sir.
this time the NEET SS exam date got postponed. So every
Correct.
year, Yogesh, as you all know, that we conduct the Elite MCQ test and discussion videos. So after Elite season 4, this is the fourth season of Elite that we were doing. Next year, or for this next NEET SS, we'll be doing Elite season 5. So Elite season 4 got over, and that is when we got to know that the exam got postponed.
Postponed.
Now, after that, many students actually messaged me that even those who were actually preparing well, they've lost the momentum, and that is when I thought of the idea of the mini test, wherein we have some small targets to be given to the candidates, because see, most of them are busy. Even if you are a final year resident or even if you are a practicing physician, we are all busy in lives at this particular point of time, unlike NEET PG days where you can completely devote to studies alone. Now we brought this concept of short mini test and giving the candidates targets so that they will strive to attain that target. Now, for a candidate like you, busy with residency, did those mini tests actually help you? And what was your approach for those mini tests?
Sir, I think the best thing in DocTutorials is the mini test. Like I felt that I would not even got this rank without that mini test. I still remember, whenever I have my duty, I'll be like, all right, tomorrow there's a test on demyelinating disorders. So demyelinating disorders is not too vast, but at the same time, it's not too small also. So I
Right,
quickly went through my notes of MS, NMO, everything. I just flipped through it, and I had solved the MCQs. Pele. For some topics, I had done it before. Sometimes I quickly solve the MCQs on that day, and next day I give that mini test as if it's my real exam. All
Right.
right, these 10 MCQs will decide your rank. I felt it in that way. And they have
Right.
this mini test is structured in such a good way that it gets over in 24 hours. And as
Right.
soon as it gets over, you'll get a live rank. So you
Correct.
know where you're standing. There were
Right.
tests. I try to I think in one test I got top 3 and I was so happy. Like, this is it. We have to maintain this rank. And there were tests when I went at very much back. Then I realized, okay, you're weak in this topic. Like, let's say I think in vasculitis topic, my rank was very bad. Then I was like, all right, Yokesh, you're very weak in this topic. Your mini test score is poor. That means others are stronger than you. So then
Correct.
I dedicated a special revision for that. I read the entire Harrison. I watched the entire video section of DocT for that, and I solved all the Qbanks for that part for weak topics. Because I feel during residency, everyone is busy. I mean, periphery, central institute, any institute, everyone is busy. But if you're
Right.
strong in a topic, just study your notes and just solve the MCQs. But when you're weak, you have to study everything, and that differentiating factor is given by the mini tests. And
Right.
one more thing, they give a schedule. I think the mini test schedule was posted in the start. Ki this thing is coming on this day. So I cancelled out all my plans. I was like, I'm not coming to any marriage, anything. This test, this day. So once you have a dedicated target, ki kal ye karna hai, kal ye karna hai, so you will not waste time. Or else how things go, all right, we studied one or two topics, you tend to waste time, you tend to chill the weekends. But when something is constantly pushing you, and I think Sundays, every Sunday was off. So what I used
Right.
to do in that Sunday, I used to revise all those 7 subjects. And
Got it.
boom, you're like that's gone in your head right now. And I think mini tests, I think this time there was a question on rheumat where rotator cuff tear, there was a question. That was a direct question.
Right.
Mastocytosis, there's a question from biopsy finding. That was a direct question.
Right.
Liver metastasis, first line treatment, that was a direct. And now these and all are like, what to say, are tough questions. And I would say these are definitely rank deciding. If you
Right.
have not read that topic in depth, or if you had solved this topic, you'll not be able to answer it easily, because these are not guessing type of also. So I
Right.
feel this mini test series is like, it's like the best thing ever. So you should just conduct this every year. Like, it's very good.
I think many candidates echoed the same feeling as you. And even when I was taking the interview of other toppers, I think if I'm not mistaken, rank 12. So
Mm-hmm.
she told me this, that she gave each and every mini test, and she said that there was probably one day where the mini test did not happen on time. Like it was, I think, around the time it actually came a bit late, maybe half an hour or so. So she said that, since that did not come, she was just anxious why this not coming, and she felt that my day would be incomplete. That's what I think rank 12 told me. I think mini test, I think this time helped a lot of candidates to go keep that momentum going as well, right?
Definitely, sir.
And regarding the importance of giving grand test, now in DocTutorials we have conducted multiple grand tests, and we have tried to keep these grand tests at different levels of toughness, because
Mhm.
see, NEET SS, as you would also know, that the exam pattern, the level of toughness is very unpredictable, unlike INI. So you will have to prepare students for all sorts of questions. So I want to know, like, how regular you have been with the DocTutorials DTs, and what is your opinion on the quality of questions as well?
So I think after my MD exam it got over, immediately I gave one GT. All right. So I know where I'm standing. So the rank wasn't very good. I think around 500 people only gave at that time, and it was around some 200 or something like that. So then I was
Right.
like, all right, let's give monthly 1 or 2 GTs, and I wanted to give it live. I feel giving live is very important, because when you give a GT live, you know what your competition is, where you stand. Because even if you get it later, it will not make much sense, because your other competitors will also would have studied, because it's
Right.
not like an MD exam, it's a competitive exam. So, and
Right.
I feel the quality of questions was also equally balanced. They had tough, they had low, and it had an equal balance of Harrison based and non-Harrison based. And even though
Right.
I felt so this paper wasn't very much Harrison based, a lot of questions, if you are actually very strong in Harrison, they are definitely solvable. It's not
Right.
like you cannot solve, you have to read SS books. I think gastro was a bit off, but other than gastro, I felt that other systems were if you had known Harrison very well, you could have definitely cleared it, sir.
Right. Now, coming to something that I'm sure many second year and final year residents would want to know from you, will be on time management. Now, can you just give some tips for the students on time management? Because see, it's not easy to balance everything in life. You have to be punctual in your duties. You have to do all the ward work, patient evaluation, and again, your learning has to be patient centric as well. And along with that, if you get time, you can prepare for the PG entrance as well. But I'm generally asking, it's not just pertaining to exams alone. In life, over many years of my teaching as well, I've come across residents who tell me always that, sir, time, when you want to manage, it's getting difficult. It sometimes gets overwhelming. I'm sure that every one of us, you, me, will have good days and bad days. But based on your experience, can you just tell the viewers on, how well you manage time during your residency days, so that you were
Sir,
happy mentally, physically, right? Right.
Sir, I feel more or less consistency is the name of the game. Now, if you are going to just prepare for 2 to 3 months, it will look like a lot on the plate. And that time also duties will be there. Now, I think there's easily 6 to 8 months for an exam. If you
Right.
start solving questions from now, if you divide, if you include both the question banks, will come around 5,000 MCQs. If you solve daily 20 to 30 MCQs, which will hardly take hardly 20 minutes. All right, I
Right.
still remember my rounds start at 6:37, and after coming, I take a nap, I freshen up. 5 to 6, 1 hour, I will just solve MCQs, and I'll
Right.
try to understand. My
Right.
ICU rounds, everything get over at 10. After I come back, I just review it. Okay, where I went wrong, where I went wrong. So that's that. Even if you just do the bare minimum, this will also help you in your concepts in MD. It will help you solving it, because in medicine, I feel that knowledge never goes a waste. It will
Right.
always be of some use somewhere or another. So when you try to divide it, if you start early, it's an extreme bonus. Don't try to wait till the end. Last mein dekhenge, last 2 months, last 3 months. Let's focus on this. I feel if you're in a final year right now, you should be preparing for your MD final, and simultaneously you should be start solving your MCQs. I think 20 to 30 questions per day shouldn't be much.
Right. All right. And again, if you had certain bad days during your residency, like maybe hectic duties, how did you keep yourself mentally composed? If for the residents, maybe first year, second years, what would be your advice on that?
So first year, sir, in I think in Pan India, almost every college is extremely hectic. All right, so
Right.
I don't expect anyone to prepare for an entrance exam during the first year, and I think it shouldn't be done. Also, I used to carry my Harrison with me to the wards in during night duty. I used to keep it with me. I used to read heart attacks, because raat mein hamesha we used to get heart attack patients and all. So that used to be like that. Interns, we used to enjoy and this and that. So it was like a fun way. So once it comes to second year, you have a responsibility. Now it's time to evaluate cases much in depth. So we used to get a lot of rheumatological cases, so I started participating in a lot of rheumat quizzes. All right, so in that way, my rheumat was so strong that I didn't have to waste much time in rheumat also.
Right.
So if you're participating in quizzes, anything, it's always of great help, especially like subjects like nephro, hemat, where people tend to ignore a lot. I feel if you start to master those minor subjects, it'll be of great. And all these cases come. Now, if you're going to get a CML case, obviously everyone will get. Just go home and study CML in such a depth so well for your general practice also, for your entrance exam also, and just solve the question bank. Done. So that concept is in your mind. So yeah.
Yeah. So I think I would agree with you. Like, okay, first year, I think will be mostly ward work, and
What?
second year, I think it will be a good idea to participate in the quizzes he was referring to. Even I did the same, and I felt that during my residency days, during both the MD as well as DM, second year is one phase where I participated in maximum quizzes. And even Yokesh, I think the rheumatology quiz that you were referring to must have been the SD Deodar national quiz for the by the
Correct,
Indian
sir.
Rheumatology Association. So I was a
Yes.
national winner of that quiz as well. I was all India first for that quiz. Myself and my friend Dr. Mithun, we
Nice.
were the teachers for that. So even I participated in multiple quizzes, like
Mhm.
Indian Society of Hematology blood transfusion
Mhm.
quiz, neurology quiz. The thing is, it's not just about winning or losing, but again, it's about the target. There is a
Exactly.
quiz coming up next month. So if I can finish up some rheumatology topics, at least it's giving me a target. Even when
Exactly.
Yogesh was talking about the mini test, he had a target. So I again, I have the same opinion. Like if you have a target, then you would at least strive to achieve it. Whether you win or lose is another story. But for the residents, I would strongly vouch that if your department allows you to participate in quizzes, please do attend, because during that phase you can just focus on one particular subject and know more about it as well. Now, Yokesh, just want to know about the super specialty exposure. Now,
Mhm.
one query that many students have is how important is a super specialty exposure during the residency days? What is your opinion? Because you said you are actually interested in gastro. So, was it because you had gastro in mind right from the time you joined medicine residency, or was it like no, I got exposed to gastro and then how was it?
So actually, when I initially joined, my interest kept jumping from one branch to another. All right.
Okay,
So eventually, like actually, I'm in a peripheral college, and here the academics is not good at all. All right. So there is only
okay,
one established department, which is cardiology, which runs very well. Other than
okay,
that, the other departments are not so well established.
right,
Neurology is doing pretty decent. Endocrine was like fine. So I didn't get much exposure. All right, but
right,
gastro, though, I had zero exposure. So what I did is when I went home for vacations, I went to one hospital near my house. So there they
okay,
have DNB seats. So
okay,
I went and worked. I just sat in a gastro department for a full day. I told sir,
okay,
hi sir, I'm a student. I just want to sit in your department. I sat in their OPD. I sat in their scopy room. I did the
right,
same sitting in a cardiology also because I
right,
wanted to see how I felt one thing that I wanted intervention for sure, but
right,
I was confused between cardio and gastro. But then
right,
one thing I realized in cardiology, you have to regularly do night shifts lifelong. And now
right,
night shifts might be thrilling, you're going to save life, do plasties and all. But I feel after the age of 30, 40, you will be exhausted, right? Waking up in the night and this and that. So I felt I didn't want that life. So I wanted
right,
something a non-emergency, but at the same time some interventional also. So I've experienced that department, even though my college didn't have, and near
right,
my college there is some scan centers also where they conduct scopies. So I went there, I just Saturday, I look at the images, stay
got
familiar with it, create a interest. So it just happens. I feel when there is a will, there's always a way. So if you
right,
really like a branch, I feel it's important that you should experience it, because I feel some people do leave a branch, they pick one, they leave it. It's not only about you're wasting a seat, but it's all your also your mental health also, right? Because already we are all almost 28, 29, 30. So I feel at this year age, every year is precious.
yeah. And I think at this point, I would also just want the viewers to know about the PG residency course of DocTutorials as well. Yokesh, I'm sure you're also familiar
Yes,
with
sir.
that.
I
So,
was very sad that you guys launched it very late. I mean, you guys should have launched it in my first year, second year. I would have been gladly taken that. But yeah,
so basically, I think the PG residency course was introduced with a concept in mind because see, NEET SS, I'm sure that candidates would be preparing during the final year or maybe second year, but something for the first year and maybe even second year and third year as well, but mainly for first and second year residents, wherein during residency to give them a patient centric approach. Because see, you have to know how to say treat common diseases at least common diseases like, say, a urinary tract infection, according
Mhm.
to the standard protocol. See, UTI is such a common disease, but to treat according to a standard protocol is important. To treat diabetes according to the standard protocol. So, just to make all this simpler and more accessible to the students, because see, the problem is most of the guidelines are pages long.
Correct, sir.
You come up with a guideline. Even say recently there was a guideline for subarachnoid hemorrhage, so I took a
Correct, sir.
lecture for
I was
that.
about to say that only. Like you posted a video on SAH 2023 update
Yeah.
guideline, and I watched that video,
The
sir.
thing is, I have to read the entire document to come up with a lecture on 45 minutes to sum everything up. Which means it is actually a big task to finish the entire guideline so that I give the students the gist of the guideline, what is required from the point of view of a resident. So that is the concept of the residency program. So Yokesh, what would be your suggestion? If you had, like you said, you had taken the SS program, but if you had taken the PG residency program, you're familiar, like we have got
Mhm.
the examination videos. How would you have utilized such a program,
So
like a
I
PG
think
residency?
it's going to be quite simple. In my first year, I used to carry Harrison with me. So instead, if I'm going to have my phone, if I'm free in the ward, there's no work to do. I mean, everyone who are posted in 24 hours, 34 hours, 36-hour shifts, they will be definitely having some free time while in the hospital. So you
Right,
can go through the videos, you can learn the concept. Like you told, so UTI is a very common thing. Diabetes, basic emergencies like SH. Also, I get so many patients, and everyone will be so confused what to give, when to
right,
give fluid, when not to give. So once you're clear with the concepts, it's about your serving, doing a better duty to the patient also, right?
right,
So your
right,
concepts improve, you're a better doctor, and I feel that matters a lot. because becoming a better doctor in your own field is very important.
Right. And then coming to the final point, like the course that we have in DocTutorials, we have
Mhm.
tried to put a structured course wherein the motto is something for everyone. Because I get a lot of messages from aspirants, maybe a first year resident, second year resident, final year resident, post MD, and I understand that the wants or the demands of each of student is different. Like
Correct.
someone who is in final year, just starting the preparation, has less time to watch the videos, but maybe he wants to practice more of MCQs, be it from the Qbank or the mini test or LI test and discussion. He wants MCQ practice. So this sort of a structuring of the course in DocTutorials into the main videos, QRP
Mhm.
videos, because you also told me that you had watched the oncology revision videos because you had some problems with or the oncology part. So
Correct.
main videos, revision videos, elite test and discussion videos, Harrison tables and flowchart videos, then these Qbank mini test, such a structuring of program so that there is
Correct.
something for everyone. You can choose it. Just like you had less time with you. Okay, you thought that these systems, let me watch the videos. The others, I'll do the mini test and then come back to the or mini test along with the Qbank and then come retrospectively to Harrison. So, what is your suggestion on this structuring?
So I feel that if you have a lot of time with you, if you're a dropper, make sure that you have to watch like all the videos over there. And the elite test and discussion, it's actually very good. I missed it because I was having my MD exams during that time. So I,
Correct.
I managed to miss it. So I planned in advance that I will do the elite thing after my exams. But that's when you guys introduced the mini test. So I thought I'll stick to something live.
Okay.
So if you have more time, make sure you watch the videos and stick to a schedule. I'm pretty sure that Elite Test series is going to have a schedule of this
Right.
and this and this. So if
Right.
you're going to stick to a schedule, that will definitely push you, because
Right.
at the end of the day, when you're done with first reading in advance, and if you're going to do revision later, it'll be much easier. And even during mini test, I had to struggle a lot with my duties and all. So if you are going to be well prepared in advance, like I'm pretty sure if you're going to study cardiology today, and STEMI, which is like a bread and butter for every final year resident. Just
Right.
take half an hour extra, solve the MCQs. If you have
Right.
any doubts, you can just watch the video. It's just going to take a little more effort. And trust me, I feel, sir, me doing a MBBS from a private and a MD from a periphery, I know a value of a good institute. At the end
Right.
of the day, wherever you go as a doctor, the first question you gets thrown at you will be which institute you're from. So I've learned it the hard way. And being in a periphery, there's no facilities. So I feel the institute where you get trained matters the most. So
Right.
SS being your last degree, that's what's going to be asked. Every hospital in the interview, the first question will be from which hospital you've been trained. So if you're going to
Right.
put a slight more effort, everything will be so easy. And I think Doc Tutorials has made this so easy, sir.
Right. And I think one last point, Yokesh, for the viewers,
Yes, sir.
and especially for people like us with small tummies, how to stay fit.
So so I feel that for me, like I was actually around 108 kilos during my MBBS time.
Okay.
So at that time, I made a decision ki no matter what, I will hit 1 hour of gym per day. Even during
Right.
my residency, first year residency, even if I didn't get time in my wardroom, I used to do 1,000 push-ups. I'll be
Right.
like, "Kuch karna hai. And I feel a second most important factor is we tend to eat junk a lot as doctors. We
Right.
crave a lot. We work 12 hours and then be like, chalo, let's order some biryani and all. So I feel that should be cut down. Whenever I'm
Right.
craving, I always have protein bars with me. I just snack on that. So just healthy
Right.
choices, I think it should be fine, sir.
Right. Right. So thank you so much, Yokesh, for sharing your inputs and your journey
Absolutely.
with Doc Tutorials as well.
Yes, sir.
We actually feel proud that you've got this rank in your first attempt itself, and I really hope that you turn out to be a wonderful gastroenterologist and keep inspiring others as well. Thank you so much for joining. Bye bye. Thank
Absolutely.
you.
Absolutely, sir. Thank you.